The USC Center for Artificial Intelligence in Society is a joint collaboration between USC's Viterbi School of Engineering and USC's Suzanne Dorak Peck School of Social Work. We are bringing together researchers from around the world to advance artificial intelligence to solve complex social problems.
One of the main thrusts of research that we have going on at our center is what we're calling algorithmic social interventions. And the issue is that interventions don't always work as well as we want them to. And this AI technology enables us to make predictions about what sorts of strategies might be better than others, and it allows us to be more impactful as interventionists.
What's unique about this work is the collaboration between computer science and social work at a university-wide scale. This is the first in the world for this kind of a collaboration. One of the things we are most excited about is our work with youth experiencing homelessness and how to use AI to spread information about HIV among the social network of these youth.
Youth experiencing homelessness are 10 times more likely to have HIV than the similar age group that are housed, and a lot of it's due to needle sharing and unprotected sex, along with misinformation. Typically what we do is we go out and we try to identify a peer leader who is someone who has the most influence among their social circle. We invite them to a training and we teach them information about HIV so that they can disseminate that information to their peers. Some challenges that we have identifying peer leaders in the drop-in center is we don't always know who the most popular person is. So it ends up being a lot of assumptions, and we end up doing a lot of guesswork.
As researchers in Viterbi, what we can bring to the table is artificial intelligence techniques that can help complement what the social workers are doing. And what the algorithms can do is look through the social networks of the youth, which contain a tremendous amount of data about who's connected to who will be able to influence who. And that helps us build the team of peer leaders that's going to be best positioned to deliver the intervention. In partnership with social workers and with drop-in centers here in Los Angeles, we've been conducting field studies of the algorithm, and we've seen tremendous success.
What we found in these experiments is that the way information spreads from individual to individual is very different from how it's been modeled in our literature. So completely new models of how information spreads have come about because of this study.
What a beautiful way to kind of like marry this tech world with this social service world, and how we can kind of go deeper and impact young people and elevate them. I would never have thought that that was possible.
Substance use and abuse among young people who experience homelessness is a significant public health issue. Researchers and practitioners have been trying for a long time to understand how these young people are connected to each other and what kind of substance use behaviors they're engaging in, so that what we can do when we put these young people in groups throughout the intervention is that we optimize positive influence and minimize negative influence.
Our algorithm uses information on the drug-using behavior of the individuals in the network and on their social ties to strategically decide how to allocate each of them to different intervention groups. With this technology, the interventionist can actually be confident that the intervention they will conduct will be effective.
For us to be able to understand how to build cohorts of youth that can be successful together is so important, because positive influence is key to what we do, and the opportunity to look at this algorithm and how that fits together with the social components seems to me as the natural fit to carry us forward in what we want our practice to look like.
Our work with HIV prevention was using social networks to spread information. Our work with substance abuse prevention was focused on compartmentalizing information in social networks. One other way you can look at it is how can we use social networks to monitor others for suicide prevention.
Unfortunately, we've been seeing upward trends in terms of increases in suicidal thinking and suicide behavior in the college population. These youth are undergoing a lot of major life transitions, right? So a lot of major life stresses.
How can we help people identify those that need help earlier so they're getting support and we're getting them connected and they're getting a sense of community before they feel so isolated and alone and hopeless?
One of the major ways has been gatekeeper training. We're trying to teach individuals who are likely to come in contact with individuals who are at risk, how to recognize that risk, and link them with more professional care. The challenge with these existing trainings are that we can't guarantee that every student is connected to individuals who have received the training.
On the engineering side, we are developing mathematical models and optimization algorithms to help to strategically decide who we should be training. Our intentions are that each individual in the network should have at least one friend that has received the training.
If you think about training as sort of a safety net, the idea is to develop an algorithm that can ensure that that safety net is under as many college students as possible.
This started as one project, and we thought it was really cool. And we didn't think we were going to create a new center. We didn't think we were going to create a new field of study. It emerged because of the chemistry that these social work scientists and these computer scientists have when they get together. And there's all of these new ideas that neither side ever thought about before.
We've created this new area of research called algorithmic social intervention. And the potential for this collaboration is enormous. Really, sky's the limit for where we can go with this.
We have the capacity to take computer science, algorithmic thinking, and applying it to how we can design interventions better. We think it truly has the promise to improve people's lives and make the world a better place.